In the last video, we talked about the three fundamental planes of the body: the sagittal plane, the frontal plane, and the transverse plane. In this video, I want to talk about what we mean when we say that a motion happens in one of those planes, or what it means to rotate in a plane. So let's jump in and just really quickly review. We had the sagittal plane, which is like this. I'm slicing the body this way. We had the frontal plane, which is like this. I'll do my best to try and draw this kind of three-dimension style. And then we had the transverse plane, which is like this. So let's think about what it means to move in one of those planes. And to do that, I want to introduce the idea of an axis of rotation. So an axis of rotation is, well, you've maybe heard of this. It's an idea that we're going to spin around something. And it turns out that each of these planes of the body can define a particularly unique axis of rotation. So let's just back up and think about maybe just one of those planes of the body. Let's talk about rotations in the sagittal plane to get started. So let me redraw the sagittal plane, and this time when I do it, I'm also going to show you how this plane here, this horizontal slice, we could think of it as having one unique, almost like a handle to grab onto it, coming off like this. This is going to be an axis of rotation, and it's going to be perpendicular to the plane at every point. So you might think about, if you had the plane like sitting on the ground, there's like one vertical line that comes up that's perpendicular to the plane at all points. So when we say something happens, a motion happens in the sagittal plane, what we really mean is there's something that is rotating entirely within this plane, which an equivalent way of thinking about it is that it has an axis of rotation perpendicular to this plane. So you might be wondering, what on earth do I mean by that? Let's take a concrete example. Let's look at the knee joint. So to a first order approximation, we can think about the knee as a really simple, like a hinge, like a hinge on a door. So the knee can flex and it can extend, and that happens as a rotation in a plane. Let me show you in my simulation software here. This is called OpenSim, by the way. I don't know if I mentioned that, but it's great, freely available software developed by some biomechanics researchers at Stanford University, and we use it for quite a lot of stuff here. Let me first, I'm going to move one of the legs out of the way, and by doing that, I'm going to rotate it in the sagittal plane. So, oops, that's not the sagittal plane. I want to flex and extend the hip. Here we go. So notice how this leg, this hip joint, it's like swinging in a horizontal plane of the body. So I move it up like this, move it back. It's swinging, moving, rotating in the sagittal plane. So going back to the blackboard here, when I'm doing that, there's an axis of rotation that's coming out like this. So that rotation is happening. If we draw like a simplified diagram of it, that rotation is happening in the sagittal plane. All right, so there's like axis of rotation, and the hip is swinging in the sagittal plane. I can do the same thing with the knee joint, for example. Go down, I can grab the knee, and I can flex it. That's happening in the sagittal plane. As you might guess, it's perfectly possible to rotate in other planes of motion as well. You can rotate in let's say, the transverse plane. What's a good example of that? Maybe shaking your head side to side, maybe twisting your torso, doing a twist of your torso, or doing a lunge with a twist in it. Those would be motions in the transverse plane. finally, we can also rotate in the frontal plane. So let me draw that, and maybe while I'm doing this, think about let's keep it for now. Think about what a rotation in the frontal plane might look like. What kind of a motion in the frontal plane? So what would it mean to rotate in that plane? Maybe, and we'll learn about this terminology next week, I think, or perhaps later this week, abducting your hip, rotating it out like that, or raising your arm out to the side, like maybe you're doing a dumbbell fly exercise. That would be a motion in the frontal plane. So hopefully this gives you an idea, and maybe I can show you one example of that in OpenSim here. Let's move the left leg, and of course we mean the patient's left leg. Let's move the left leg in the frontal plane. Let me find hip adduction left. So this should be frontal plane motion. Yep, there we go. So this is leg motion in the frontal plane. And since I've got this open, let's look at rotation. Well, let me move this back. Before we get into multi-plane motion, let's look at internal, external rotation. Notice that's a rotation happening in the transverse plane. Back on the blackboard, that's this yellow plane right here. So that's how rotation happens in each of the planes of the body. Before we close, I want to show you one more slightly complicated thing that we'll come back to in the future, but I just want to highlight, which is that it is entirely possible to have rotations that happen not, say, in one plane. And a good example would be maybe this subtalar joint. So let's to make this more clear, let me hide the muscles here. And let's manipulate the left subtalar joint. So notice as I rotate this, the foot is moving about the subtalar joint. And the tricky thing about it is that axis of rotation is not oriented in any of these three planes of motion. It actually comes up something like this. The subtalar joint has an axis of rotation that kind of comes up and off the ground. So I just want to show you that briefly now to make sure that you realize that you can have axes of rotation, or an axis, just one axis of rotation, that doesn't happen in one of these three fundamental planes of motion. However, almost all of the motions of the body, or the major motions, do happen, right? Hip flexion and extension, that happens in the sagittal plane. I suppose I should probably label that for you, shouldn't I? That happens in the sagittal plane. Knee flexion and extension, that's in the sagittal plane as well. Hip adduction and abduction, that's in the frontal plane. Maybe twisting your spine, twisting your neck, shaking your neck, that's in the transverse plane. So that's how rotations can happen in 3 dimensions. And then in the next video, perhaps next week, we'll talk about what it means to rotate or move outside of these planes of motion.